So lung cancer disproportionately impacts underserved populations. How does CIBL help reduce health disparities?
So, I mean, we know CIBL works in our population. Our population here at UIC is 70% African American in the lung cancer screening space. So, I think the fact that CIBL is validated and works well in our population can be one way that we could potentially ameliorate that disparity. I think, the things that Mary and myself are working on now are the prospective studies. And a lot of these studies are designed to screen outside of the current guidelines, right? We know that we're not picking up, especially in our patients, we're missing a lot of patients, right? That the current guidelines don't work well for our patients, right? And so a lot of what we're trying to do is kind of figure out, can we use CIBL? Can we use other things to kind of screen outside of the guidelines to pick up more people who are at high risk for going on to develop lung cancer?
Yeah. When it comes to using artificial intelligence, we talk a lot about, training and validation data, especially with diverse populations. Can you discuss how the consortium ensured that data from diverse racial and socioeconomic backgrounds were included during training and validation?
So I think that was one of the issues that they ran into when they started, that they validated this initially, or trained it initially on NLST data, which is very homogeneous data, primarily I think 95, 96% white cohort, right? And so that was what really gave rise, I think, to this consortium, was the fact that we need to include much larger number of patients, but also a much more heterogeneous population. And so, it was nice that, there was a Taiwan group that validated a Taiwanese population. But again, that was a homogenous population as well. So trying to, when they were kind of creating this consortium, ensure that there was a lot of representation, that when we validate CIBL in this population, it's going to, we're going to be able to tell, does it do perform better in this group? Does it perform better in this group? And so that's really, I think, one of the reasons why there was interest in for having UIC involved, was because we are an academic institution that does have a very diverse population. And so, could we use CIBL in that population? And how does it do? And now we know, it performs pretty well in our population.